I'm James Piotrowski. This is Chapter 9, Medicaid Reimbursement. The Suitable Representative Program was created out of the KW litigation when the Federal District Court required that each participant in the Medicaid DD program be provided a suitable representative to help them through the process. That suitable representative can be anybody the participant chooses. But to the extent that they don't have somebody who's prepared to represent them, the KW settlement agreement required that Health and Welfare be prepared to pay targeted service coordinators and support brokers to serve as suitable representatives in those circumstances where they're needed. The Suitable Representative Reimbursement Program is still being developed, unfortunately. We do know some facts about it. First, this is going to be a non-Medicaid service. So your Medicaid provider agreement and your current accounts for invoicing the Medicaid program are not going to be the same for the Suitable Representative Program. That's for the simple reason that Medicaid funding from the federal government is not available for this program. So instead, suitable representatives will need to execute a separate contract with the Department of Health and Welfare covering this program. That contract is not yet available. The Department of Health and Welfare has been working on it. The lawyers for the plaintiffs in the KW case, meaning myself and Mr. Epping, have been working with the department trying to develop a suitable contract to provide for reimbursement. The rate, we think, has been settled, although the slide says it's still being addressed. It hasn't been finalized. We think we've reached agreement that the rate will be the same rates that are currently paid for service coordinators and support brokers. As part of that, each appeal, each case in which a participant decides to pursue an appeal, there will be 8 hours of reimbursable service available presumptively. Beyond that, additional hours will be available, but we're still negotiating with the state over how and when those hours will be available. The dispute at the moment still concerns a prior authorization or subsequent authorization. We'll keep you up to date on when the suitable representative contract becomes available. We are hoping that when it does become available, the reimbursement will be available retroactively to late 2017. So please, if you find clients in need, do your best to serve them in the hope of getting paid later. You can keep an eye on two websites, ourhealthandwelfare.org and idahodisabilitydefense.org, for information about the Suitable Representative Contract. For those of you who have completed either these video trainings or one of the live trainings covering the same material, we're maintaining a list so that we can get you that information as soon as it's available as well. Hopefully, in the future, you'll have the opportunity to represent your clients, to do so effectively, and to get paid for your time, which we all know is valuable. Finally, again, as part of the KW settlement litigation, we now have a TSC support broker training hotline. The hotline is available for anybody who's serving as a suitable representative, whether paid or unpaid. The phone number is on your screen and is also on the materials that you can download. And it is a direct line to reach one of the lawyers involved in the case who can help talk you through difficulties relating to budgeting, budget appeals, plan denials, and plan denial appeals. Please, by all means, give us a call. It's free to you. We'd love to help you sort out these cases and bring the best appeals that you can. Thanks also for sitting through this entire video training series. We know you do it for lots of reasons, but that at least one of those reasons is the desire to serve the people in the Idaho DD Medicaid program. We wish you the best of luck with that, and we look forward to working with you in the future to make that happen. Thanks very much.